Yeah, good evening, everyone. Welcome to today's edition of the exams series. We'll be starting with a FRCR 2A structural approach to ace the exam. This is organized by Radiology Interest Group Africa, RIGAf. So today we have two presenters. They are currently ST3 radiology registrars who are practically ST4 because by next month they'll be ST4. So we'll be starting with Dr. Mustafa Ibrahim, who is ST3 slash ST4 radiology trainee in West Midlands, currently in Stanwell and West Birmingham NHS Trust. So, Mustafa, if you are here, I can see that you are here. I would like you to start.
Hey,
Thank you.
hey, just give me 1 second. Right, hi everyone. So I'm going to be looking this way because my laptop's there with the presentations in front of me. My name's Mustafa, as folks said. I'm one of the ST3s in the West Midlands, and I've come to talk briefly about the 2A exam and sort of my approach to how I prepared for it and what the 2A exam is. So this is the layout that I've got. It's a fairly short presentation, but we're just going to have a quick introduction to the 2A exam. Then we'll talk about some resources, main resources that most UK trainees typically use and recommend, and then question books for preparing for the actual exam, and then just briefly what my strategy and experience was with the 2A exam. So the 2A exam is probably the biggest of the radiology FRCR exams in terms of how long it takes to prepare. UK trainees typically sit the exam at the start ST3, so that's roughly 24 months of radiology training under their belt in the first 1 or 2 months of ST3, so you can say it's maybe 26 months of radiology training. The exam's 2 papers on 2 separate days. Each paper has 120 questions, and you get 3 hours per paper. So it's a total of 240 questions. And it's unlike the anatomy and the physics exam. You can fail one day basically and make up for it on the second day. It's your gross mark that counts towards your overall mark. And the pass mark varies and just depends on how well everyone scored or how poorly everyone scored. I can't remember the name of the scaling that they use here in the UK, but it basically just depends on how well or poorly everyone did that on that exam. But you're looking at around the 65%-ish mark for a pass. There's no images in the exam, it's all words. That's good and bad. If you're not particularly good at haven't seen that many things in radiology, it's obviously better, but it just depends on the people who write the question. They will use their own descriptive terms. So you do have to sort of get used to that. And there's 6 modules that are covered in the exam. I think historically the exam was 6 separate papers. So you basically had to know MSK radiology, and then you'd go in and sit in 75 questions. MSK radiology, same with neuro, same with cardiothoracics. But they scrapped that. I think they said that the fail rates were really high on these exams, and it just meant that trainees were doing a lot of exams. And now they've just encompassed it all into one, which has its pros and its cons, because with it being all in one, you can, if you're not particularly good at one subject, you can make up for it in the same paper. But the downside is if, let's say, one subject lets you down and you do well in the others, but you still fail, it means that you have to revisit everything all over again for the exam. So the resources for learning radiology, the vast majority of UK trainees will use either Crack the Core or Core Radiology or both. They're sort of the revision guides that are recommended by most people, and most of my colleagues have used one or the other. There is a more extensive textbook called Radiology Review Manual by Dana, but I tried to look at it, and personally, I thought that was too extensive for the exam, and it was just impossible to learn anything from it. That was my experience. But if you're the type that enjoys reading really information-heavy books without a lot of pictures, that might suit you. I haven't included a picture of that book, unfortunately, because I just didn't use it. But that is, I think, the gold standard textbook, supposedly what the RCR exam is based off of. And there's another little book that I came across that I only used towards the tail end of my revision. This red one here, the final FRCR complete revision notes. That's super concise, and wouldn't recommend using it on its own, but because it's the only one that's British, because both Crack the Core and Core are American books. It's the only one that's British, and it highlights the high yield things in sort of bullet point format. So if you have time, and you can probably read it in a week or so towards the end of your revision, but I definitely recommend one of these two as textbooks. They both have their drawbacks and their positives, which I'll talk about at the end when I'm talking about like my strategy and sort of experience with 2A. But I'm just kind of giving an overview on the resources that most UK trainees use or recommend. Google's going to be your friend, because Radiopedia or StatDX, depending if your institution gives you access to StatDX, Radiopedia's basically got everything, and if you just used Radiopedia for the exam, then all the questions will be coming. You'll find all the answers in there. But the problem with Radiopedia, using that alone, is that it's not very organized. Having a revision guide that sort of structures your learning is probably the best way to go about it. But what I found is when I was studying for the 2A is that I was Googling a lot of things, and I just got into such a habit that even after the exam finished, I was like typing in things like, I don't know, Joe Biden, Radiopedia, just because I was so used to Googling everything on Radiopedia that I was reading. The other golden nugget that I found really helpful towards the end was the Radiology Society, the Society of Radiologists in Training. They hold free sort of lectures on Teams or Zoom, sort of in the lead up to the 2A exam, and they have some of them available online for free on YouTube. And I found those really, really good. Wouldn't recommend watching them early on because they're fairly heavy on sort of high yield exam style questions. But I found it really, really good and definitely worth watching sort of in the last 4 weeks before the exam. It's sort of, they're recorded lectures that are in a question and answer sort of basis. So there's like no pressure on you, but you're just watching to see how other people answer. And then the consultant who's presenting is giving the rationale as to why that answer is correct. But yeah, a lot of information in those videos that you won't find in textbooks. And I think those sort of resources will cover you in terms of what you need to actually learn the content for the exam. Again, I'll revisit this a little bit later on, but my advice with regards to the revision textbook is I would say just pick one, whether it's Crack the Core or Core Radiology, and stick to it. Both of them don't necessarily have all the information that you need, but because you'll be Googling, you'll be doing questions, and you'll be attending lectures and stuff, you can fill in the gaps. But yeah, you don't want to overwhelm yourself with reading a bit from this textbook and then a bit from that textbook. My advice would be choose either Core Radiology or Crack Core, and stick to that. Stick to whichever one you prefer. I think generally Crack the Core is more exam focused, so it's like the question, the way it's written to prepare you for MCQ style exams, whereas Core Radiology is just more of a generic textbook. But if you prefer that, then go for core radiology. Crack the Core, I liked it because he made some jokes in there and it was a bit easier to read. But yeah, that's just sort of my advice on Crack the Core versus core radiology. Personally, I only used Crack the Core. I did try to read core and then I couldn't finish it, and then I switched to Crack. But yeah, just decide for yourself which you choose, but I'd recommend sticking to one and then using the internet and those SRT lectures to fill the gaps. Question books and banks. Again, there's a lot available online. The ones I'm going to talk about are the ones that I did, which is those 5 here. I think there are others available, but they're older, and I'm not saying they're bad, I just don't have any experience with them. So these are probably the most recent ones. Well, I think they are the most recent books. So I'd recommend doing those and doing them extensively rather than having a wide variety of questions and not dedicating as much effort into those kind of questions. So sometimes less is more. And I think on the next slide, this is the order that I did the books in, and it's also the order that I would rank those question banks in. FRCR Exam Prep is the only one that's online. It has the most number of questions. It's 1,600, give or take a few. It's online. My experience with FRCR Exam Prep, I found it very... I felt like it covers the bulk of the curriculum. So if I only had to choose one question bank to do, I think I'd probably choose this one. It is a bit easier than the real exam, but I felt like doing that question bank extensively prepared me a lot more for the exam than when I didn't. So for context, I had to take the exam twice. And the first time I didn't do FRCR Exam Prep as extensively, whereas the second time I covered it maybe 2.5 times before the exam. And personally, I found that was the difference. So I would say that the questions are easier, but I would start early and try and get through that question bank twice before you set the exam. The next book was the Oxford SBA's book, which was this one here, this red one here. That was 450 questions, and it was in the older modular format. The questions are much more difficult than the 2A exam, in my opinion, and I would use that as a learning resource. So also I would recommend doing that one quite early. You'll get a lot of things wrong, but the explanations are very, very good. So it's worth doing slowly and extensively to build up your knowledge. The third book is this BIR Imaging Single Best Answer, which I believe has an app for Android, but if you use Apple, you have to buy the book. This one probably represented the exam the best because the stems in the exam aren't particularly long and they do feel a bit vague sometimes. And I think this one, in my opinion, was overall the most representative of the real exam. So I would also try to do that one early, twice if you have the time. But again, the explanation is also very, very good. So definitely would highlight that one as a resource to use fairly well. The next book is the final FRCR self-assessment, which has 4 mixed mocks. This one here, and that's the companion book of the Small Red Revision Guide. That's the newest book. I think it was published in 2021 or something. Again, also very good and, in my opinion, fairly similar to the real exam. But again, the explanations and reading around the questions is where you'll do the most learning. So I wouldn't just rush doing it. And then the last book is this Get Through one, the orange one, which is here. It's a good book if you've got a lot of time, but if you're short on time, I probably would have prioritized doing it. So I didn't do that one when I was taking the exam the second time. The questions, from what I've been told, are the RCR doesn't like negative questions, so it doesn't like questions that are sort of worded in the which of the following is true, everything in the following is true except, or what is not a likely diagnosis. And that had a lot of these kind of questions, which beneficial for learning, but it didn't really mimic the real exam. And I would only do it if you have a lot of time. And the last bit was the sample RCR questions. So there's a PDF talking about preparation for the 2A exam with 30 questions with explanations. And then on the RCR website, there's 11 questions with no explanations. Again, definitely recommend doing those because from memory, I think there was one question that was repeated from these 41 questions in my April exam. So definitely do those later on in your revision prior to the exam. Yeah, and I think as far as questioning books, these are the main ones that I'd recommend and the ones that I used. Yeah. I'm just going to talk a little bit about like my experiences and tips for the 2A when you come to do it. Timescale is usually one of the first questions, and I think that will vary from person to person. For most UK trainees who've done 2 years of radiology, I would say about 4 to 6 months is the time needed with working extensively with a full-time rota. Sorry. If you've done previously medicine or you've been in radiology for a long time, you might need less, but I think 4 months alongside working full-time is a fairly a minimum, but I think that's like just a fair average. You can kind of know how long it'll take you to build the knowledge and get into the flow of the exam and pass it. But yeah, it'll vary from person to person, but I would say for the bulk of people who are maybe 2 years radiology experience working full-time, I'd say at least 4 months. As I mentioned before, crack the core or core radiology. I'd honestly just recommend pick one of them and just stick to it. Annotate from other places, do your reading from Radiopedia, add stuff in. I prefer physical books, so which I still can't do like PDFs and stuff, so I had to buy the physical book for Crack the Core. But yeah, annotate stuff in, read around the stuff that's in Crack the Core or Core Radiology. Like I said, they're both lacking in some information, so you can't really pass the exam without doing question banks and doing some reading online from Radiopedia. Now, this was something that had basically threw me off in the real exam, and it was said to me ad nauseum by like so many people that the exam is really vague and that you're going to be guessing between two answers for most of the exam. And I didn't realize how true that was until I sat the exam, because like both times I felt that there were two answers that I was constantly guessing between. So don't let it dishearten you, but that's unfortunately the reality of it. And I guess that's true in radiology as well. A lot of the time, there's a lot of cases where we're not 100% certain, and it is what it is. I've never really had a problem with timing in the past with exams, and this exam was the first exam where I found that I was struggling for time, that I basically finished just as the clock had finished, especially the first time. The second time was a little bit better, but yeah, timing is really important. So make sure you're working on getting a lot of practice to do 120 questions, because it is exhausting. And just general advice: don't spend too much time on one question, things that you generally just all that kind of generic stuff. But yeah, if you've never had problem with time in the exam before, don't think that means you won't have problem with this one. And the other thing is questions. UK trainees like always harp on about how important it is to do questions, and yeah, I'd probably say that's the case as well here. I didn't do as many questions as I should have in November. Like I did the books and I did a lot of reading, and the second time round, the only thing I changed was that I did FRCR exam prep a lot more extensively for April. Like I was in the morning, I'd maybe do like 75 questions, and then in the evening before bed, I'd do like another 80, 100 questions or whatever. And in the exam itself, I felt like a lot more in the rhythm when answering the questions. When the first time it didn't quite feel as smooth because I was using the books and I wasn't doing questions in the capacity that I should have. So yeah, honestly, like I know I've harped on about it, but FRCR exam prep is don't underrate it. I was told by a lot of seniors that it's way easier than the real thing, and I stopped doing it around September time, the first take. But yeah, that like if you take something away from today, just don't neglect FRCR exam prep. The other thing that is helpful for the exam is if you've got the ability to attend MDTs and speak to consultants face to face when getting feedback on scans. And that's because, like, unfortunately, there is like a good chunk of questions in the exam that you can't really just get straight from a book. And you have to have either reported that scan or that the scan that they're talking about, or attended that subspecialty, or attended the MDT to know the answer to. So if you can, I would definitely try to attend some of these things. So MDTs, and to get face-to-face feedback on scans and how consultants approach different scans and stuff, because that's definitely, it'll help you for a few marks. And the other thing which caught me by surprise in November was anatomy. You get fairly basic anatomy questions come up in the 2A. So it's like they're really important questions to not fail to not get wrong. And the reason I say that is because the pass mark, so for April, the pass mark was 149 and the average score of all candidates was 157. So you're talking about 8 marks between the average and failing. So these basic anatomy questions like liver segments, arterial anatomy, some questions on dermatomes or muscle attachments, that kind of thing, you need to nail those questions in order to make sure that you're in that realm of passing, because literally every mark counts. And yeah, just read the questions carefully, and yeah, just good luck. I've written a PDF on what I did for the 2A. If you're interested in it, you can email me and I can send it to you. But it's essentially, there's nothing really that I didn't talk about here. So yeah, I think that's all, and I'll hand back to Phil. And yeah, thank you.
Yeah, thank you, Mustafa, for the wonderful presentation.
No,
Yeah,
all good. Thank
I
you.
know we'll have some questions from the audience, but we'll take the questions at the end of the session. So I would like to
Yeah,
call the other presenter to
all good.
present for us. So Dr. Emeka Igwe, it's ST3/ST4 in Hull University Teaching Hospital. So we'll be talking on the same approach to FRCR 2A and sharing his experience as well. So, Dr. Emeka,
Thanks, Phil. I'll
yeah,
just share my
over to you.
slides. Can you see my screen now?
Yes, yes.
Okay. I think Mustafa has covered everything really. So I'll just try and focus more on touch upon a few points just to reinforce what he has already discussed, and obviously highlight some of my own personal experience as well. Um, the first thing to say is that this exam is challenging. It's a very hard exam, and the way you approach it is by actually trying to build it into your life over the next few months, particularly if you're sitting the next exam in November. But with a bit of structure and and staying organized, I think you most people would definitely pass the exam. So I think it's very important that we're sort of doing this overview, because having a structure and approach is really important. Um, so again, as Mustafa did, I'll go over the exam structure, some of the resources I used. I'll highlight a bit on timeline, because I think that's really important, especially if you're sitting in November. You really need to know what you need to be doing at this time before your exam. And again, I'll highlight a bit on my own personal strategy as well. Um, Again, the preparation can be very daunting, and I think it's better to be over prepared for the exam. So what I'm trying to say is, just do not underestimate what you actually need to know for this exam and what is actually required of you, because the content is vast, essentially the entire radiology curriculum, and they can ask you anything and any disease condition as well. And sometimes they can go into very, very little detail that you've never actually thought of as well. So it's important not to feel over prepared. It's better that you actually feel over prepared, so that that again, that's going to make the battle a lot easier as well. I'm not going to touch about the structure because we've already talked about it. Um, and again, we've already talked about the fact that the exam has switched to sort of two papers containing 240 questions in total, split over 2 days. So you typically get the morning section or an afternoon session. I think I had an afternoon section first and a morning section. I can't really remember when I started the exam in November. And so you roughly get about 90 seconds for attempting each question on average. And like Mustafa said, the final score is a combination of both papers, and is marked using the modified RIGAf method, which again uses an aggregate scoring uh, based on how all the candidates did on the particular day. So there's no definite cutoff mark. So essentially, you're trying to pass based on how good every other candidate is on that particular day as well. So which is why it's very important to make sure that from your own end, you're sort of happy and satisfied with your preparation. One thing to say is, I think looking back at the way I prepared for 2A and looking back at the exam itself, I don't think it's I might be wrong for saying this, and some people disagree. I don't think it's an extremely hard exam. I don't think it's too hard. I just think the problem with the exam is that it's just too vast. You're required to just know a lot of things over a short period of time. Again, which is why you have to have an approach to how you prepare for these things, because there's a lot of trivial stuff for you to remember, which, trying to incorporate questions early is very important, because again, you can understand how people phrase questions, how people are going to ask about stuff, because, not everything or not every part of radiology can be put into an MCQ question. So the sort of resources that you use should sort of reflect that, because you're preparing for an MCQ exam. You're learning radiology at the same time, but to be honest, what you're actually doing is preparing for an MCQ exam. So you have to think about it that way. So all your preparation should be structured into, how can I actually be able to answer questions, and how can I identify concepts that can actually be testable in an exam. In terms of the question style, again, as Mustafa said, they don't do negative questions anymore, but what they try and do is they can ask you what's the most likely diagnosis. They can ask you something around which of the following findings will be most likely in keeping with a particular diagnosis. Select a combination of different findings versus a particular diagnosis. What's the most appropriate next step? What's the most likely associated finding or syndrome? And what is the name of this particular finding or sign? This is essentially all the question style that you're going to get during the exam. And I think you should be able to study and look at your question banks based on this sort of question styles. And depending on where you find your information from, that will determine which question that is very much helpful in. Like Mustafa mentioned, for example, I think, if you've been to like the chest MDTs or some of the GI MDTs. Those MDTs are very helpful for sort of the next most appropriate treatment and sort of next best investigation as well. But again, they're not that helpful in terms of, imaging findings. They're not that helpful in terms of the most likely. They might be helpful in most likely diagnosis, uh, but not as often, not as much as what you read in terms of your normal, resources as well. And again, they can't really help you much for like associated findings or syndromes. So just try and in each resource, try and find out how you can get the most out of it. And if you're speaking to consultants or trying to get some idea, I think try and be as specific as possible. Sometimes consultants' personal opinion might not actually be what you know the person that is setting the question wants as well. So just try and get a lay of the land and just try and um, um, balance out what is someone's personal opinion and what the exam would accept as the correct answer. For example. Um, Again, just a quick overview. I know people tend to get bogged down between using core radiology, which is American, or using Granger analysis, which is, you know, essentially UK. Um, I think either or is fine. I'll probably tilt towards core radiology because I think the writing style is a bit better than Granger analysis. I think Granger analysis is a good textbook for getting a quick overview of radiology while you're in sort of ST1 and ST2. But I don't think the textbook was actually formatted as sort of an MCQ sort of exam, for example. Having said that, there are some sessions that are really good. For example, I read the MSK part of Granger analysis and I actually found that really helpful, particularly for things such as congenital abnormalities and um, trauma as well. I think it covered it really well. But you don't want to be experimenting. I would say if you're looking for a core text, you can use either or. But if you don't have one and you want a recommendation for the exam, I'll probably choose core radiology. Again, echoing what Mustafa said, I think it's formatted based on an MCQ. But again, the problem is that you can't really read it um, cover to cover. I think you have to combine it with something else for you to get the most out of it. Generally. Also be mindful that core radiology have certain sessions that are not that useful for the exam, such as obstetrics. So you can again feel free to to skip that. What you actually need is a dedicated question, a dedicated resource, essentially, um, which is Crack the Code. Because again, this book, it's not a reference test, it's not a core radiology textbook. This book is, written for MCQs. It's written for MCQ exams, and the author has gone through the painful length of actually trying to format radiology concepts into MCQ questions, essentially. Um, like this book is just, if you're short of time, or as I'm going to come to in my strategy, you can read Crack the Code twice and actually pass the exam. It's actually that good. Um, the problem is that it can be very superficial. Um, there's maybe 10 to 20% of the exam content will not be covered. Uh, in Crack the Code, you need some other resources to supplement it. And again, if you like learning based on um, linking facts together and getting a bit of a background knowledge, then I don't think using Crack the Code alone is a good idea. You need to supplement it with something else. But having said that, I think this is the most important resource um, that you need for the two exam. Crack the core and a combination of questions. You know, and I know a lot of people have passed using both. And again, you also have the reference books. I know Mustafa mentioned Dennett. It's a complex book. It has a lot going for it in terms of the content because essentially it's a manual. So the questions are actually from Dennett. That's the thing. All the questions are from Dennett. So, or maybe 90% of the questions are from Dennett. But then the problem is that how can you actually get this information from a book that is over 2,000 pages, long, and it's just full of tests with no pictures? So it's a challenging book to get the most out of. Personally, if you have a bit of time, I would suggest trying to use Donut initially. Um, and what I mean by that is, I'm not saying you should read it because I don't think anyone, if you're normal, I don't think you can read Donut. But what you should do is to combine a question bank that is very high yield, that covers all the key concepts, and then you can tease out the sort of the most common questions. For example, you know that in your exam, there are just some certain concepts that are going to be tested. You know for sure you're going to be tested on achondroplasia, for example. You know for sure you're going to be tested on, hemophilic arthropathy. You know you're going to be tested on, um, focal nodular hyperplasia, for example. These nearly 100% questions that will definitely come, or concepts that will come out, I think you should go and read the bit on Dennett. That way, you're just reading a particular section of it that is very, very high yield. I think that will give you a lot of background knowledge that you can use when you're sort of looking at other sort of superficial resources. That's how I would say you should use Dennett. And again, Radiopedia, we all know Radiopedia. I think is excellent. In my deanery, we have a full subscription to Radiopedia. So again, it takes all the ads and all the nonsense away, and you can just use the search bar just to search for anything. So usually when I'm doing questions, I have Wikipedia open and I just search for various topics. The problem with Wikipedia is that some of the articles are good and some are not that good. So you have to sort of pick and choose to see which one works. But it's an excellent resource. But again, it's very useful. As a very very good quick review. I think it's just the Google of radiology essentially. Another resource that you shouldn't sleep on is StatDX. I think, again, you don't want to overload yourself with too many resources. And I'll come to how I sort of managed to structure most of these resources because I sort of dabbled on a lot of things generally. But StatDX is very good at highlighting key imaging findings. So if you're not entirely sure from Wikipedia, from what you're studying so far about what actually differentiates, for example, focal nodular hyperplasia and an adenoma, for example, and you want to find out that key imaging feature, I think StatDX is very good at that. If you also want to know what's the next best investigation or the most specific or sensitive test, for a particular diagnosis, I think StatDX is the best as well because it's very current. It's very current. It's updated regularly. Written by top radiologists in America. So I think it's probably the best resource for those kind of questions, in my opinion. Another reference that I didn't really use is RITI. I think it's just the law, and the modules are quite old as well, and I think they require updating. So I didn't really use RITI as well, but I know people have mentioned it previously. For question banks, I think Oxford is probably the hardest by a long mile, but I think it has a lot of complex terms, which is really good, and I think you should do it when you're starting your prep because I think it will actually stimulate you to read, and it will actually explain how you actually answer complex terms. So I personally will start with Oxford because you want to do Oxford first and then do it a bit closer towards the exam because it's a really hard question bank, harder than the exam. But again, I think the concepts that the question bank test is really, really good. And I would definitely recommend it. FRCR exam prep is also another gem that people tend to sleep on, but it's very useful. It is easy compared to Oxford, and it's definitely easier than the exam. But again, it has a lot of questions, 1,600 questions, and it repeats concepts a lot, which is very good because what you actually require for this exam to retain a lot of trivial stuff is repetition. So I think FRC exam prep is really good, and obviously it's divided system by system as well, which is really good, and you can actually um, use it early on during your revision as well. Um, and then you have these other question banks, Masterpass, the Cambridge book by Stuart Curry, and the BIR question bank. I think, like Mustafa mentioned, again, I did all these question banks when I started my exam, which is why I'm showing you guys. But, I think the Oxford book is excellent. The BIR book is also very good because I think the stems are also similar to the exam and the explanations are really good. But I think what Masterpass and Cambridge offers is just questions because again, this exam is about doing as much questions as possible. And if you're the kind of person that gets through a lot of questions, I think if you've not seen a question before, it's always good for you to do another question, if you know what I mean. Because, if you've seen a question for the first time, every time you do a new question, you're simulating the exam. Because remember, none of these question banks, you're not going to see this question in the exam. So every new question that you see is simulating the exam. There's a couple of other question banks which I've excluded because I think they are very low yield and the structure is not that great. And, some of them, the answers are even wrong. But I think, definitely Lindsay, which is Oxford, the BIR one is also very good as well. FRC exam prep. When you have a bit of time, I think you should also do Masterpass and the Cambridge book as well. Again, one thing I did that really helped me a lot, I think 3 or 4 months towards my exam was I started using Anki flashcards for questions. So, sort of transcribe these question banks into flashcards and I was answering them in flashcards. And I think that was really helpful. And I think that was a big game changer for me because the questions I already know, and if I answer it correctly, I don't see that again in my flashcard pile. And I only review things that I don't actually know. So sort of towards the exam, you realize that the more stuff is sticking in your long-term memory, which is obviously what we're going to rely on in the exam, the better. So I think flashcards are great because again, you can do a question bank and finish it, but I can promise you that I will show you certain questions again and again, and you keep getting it wrong again and again and again, which is obviously very disconcerting. But that's why you have these Anki flashcards, and I think if you can apply that, I think it's really really helpful, and it will really help you sort of cement a lot of concepts that you can easily forget. And then you have this final question banks, which I think these are the final warriors. Personally, I think the get through has about 7 marks, and the final FRCR self assessment has 4 marks. And then this is a complete revision note. And as Mustafa mentioned, you can read it sort of within a week or less, actually less than that, because it's actually very condensed, has a lot of bullet points, which is very helpful. But I think even if you don't have time to read the complete revision note itself, I think these two are really important, and I think I found them useful, particularly this particular book. Again, people don't talk about it a lot, but I think your score towards the exam for this particular book will most likely reflect your score that you're going to get. That's how useful I found it. So try and resist the temptation of doing them early. You want to be able to gauge yourself as close to the exam as possible. So if you have 11 mock exams and you do about a mock every 3 days, you're going to do all 11 papers in about 33 days. So I'll probably say start doing the mocks 4 to 5 weeks before your exam. I'll probably say 5 weeks. And then do just one paper every 3 days. You do a paper, you take your time, you mark the score, you find out your weak areas, you read the explanation, you go over the reference to the explanation to understand why you feel the answers. You actually study each mock paper over a 3-day period. That way you can get the most out of it, and you're not just sort of recycling questions and recycling questions. Um, I think I'll probably start with get through, and then I will leave this one for the sort of the last couple of weeks because I think it's very close to the exam. So if you study it properly, you can do it once. But again, if you don't study it properly, then I suspect that's when you probably need to do it, twice or 3 times before the exam. I had the PDF for them, and one thing I did was I tend to highlight the PDF. So in case I forget something, I can easily come back and look at what I highlighted as well. And then finally, there are some add-on resources which I also use because remember, you're working full time. You've got families. Um, you know, you're on call. There's other stuff going on. You have your objectives to meet in terms of your training. You probably don't have time to study, and that worked for me as well. And I had other things I was doing as well. But how I managed to supplement that by using a lot of add-on resources. For example, I listen to a lot of songs for FRCR from Spotify or sort of Apple Podcast. Very helpful resource. It's not that extensive because, again, they didn't manage to make podcasts for all the study material required for the 2A. But I think the resource that they created is just excellent. So what I normally do was if I'm coming to work, I put it on. If I'm going to the gym, I'm listening to Force for SRCR. Literally, if I was doing anything where I can have my headphones on, I was listening to it. So that means that actually, if I go 2 3 days without actually studying, I've actually done a lot of studying, mainly because I was sort of listening to to songs for FRCR essentially. So there are weeks, even 4 or 5 day periods sort of over the last 3 months before the exam when I didn't actually do any other studying apart from just listening to podcasts. Other podcasts was, Radiological Exam Review and the Radiology Review podcast. Again, these are American podcasts, so they are not very close to what you would expect for the FRCR. But I just think if you are struggling with the concept, you can just find that particular topic and just listen to it. I think you have to treat the 2A as a concept-based exam. I don't think it's an exam where you read and understand an entire, shall I say, an entire system, for example. I think you have to pick up concepts and then try and understand that concept thoroughly. Because there are some very high-yield concepts that you're almost guaranteed will come out in the exam. And it doesn't matter where you learn it from. You can learn it from videos, you can learn it from audio, you can learn it from textbooks, you can learn it from Crack the Code. But just know that you have to learn those concepts. And that's what's actually going to help you during the actual exam. Again, YouTube is excellent as well. Again, you can watch a few videos. I found the SRT videos are great, and I agree with Mustafa. I think you should listen to them maybe 4 to 6 weeks before, maybe I'll probably say a couple of months before your exam. Very, very useful. I think during when I was sitting the exam, I think that was when they were sort of doing the videos. So I sort of followed the series as it was coming out. So I was listening to them. So they are very useful, all of them. Very, very useful. Dr. Matt Jones' cardiothoracic lectures and the neuroradiologist channels are also very good as well because if you're just trying to learn about the particular topic, but I don't think they are very focused in terms of MCQs. But if you're struggling with a particular topic and you need a video to go and learn, then you can always look at them. The radiology core residence lectures are also useful, but again, I don't think this is useful for someone sitting the exam in November. I don't think you should use it. I think it's useful for someone that is going to see the exam next year. You can just start watching these lectures now. You don't even have to study anything. You can just watch the lectures. And again, you might dabble into a bit of radiographics, a bit of radiology assistant. Again, throughout my preparation over 9 months or so, I sort of looked at stuff from all these sort of resources from time to time. But again, I don't think these are necessary for the exam. So I think you need about 6 to 9 months minimum. Um, I think 6 months is probably the minimum recommended, and you can do, you can say 14 hours a week. Let's say you do, you know, uh, 1 to 2 hours every day when you're working. So you can do an hour in the morning, an hour in the evening, or 2 hours in the evening, or 2 hours in the morning. And then, if you do that Monday to Friday, you have already done 10 hours, and then you can do 4 to 8 hours on a weekend. And then you can do, obviously, this is very varied depending on, on individuals. But obviously, towards the last 3 months, you need to obviously ramp up your preparation. And you should be doing minimum, 14 hours every weekend or 7 hours every day you're off, towards the exam. Obviously, it's important to plan your study and annual leave in advance, and then create a study plan that works for you long term. Because one thing you don't want is you want to be able to ramp up your preparation over the final 6 weeks. You don't want to be tired at that point. You don't want to be burnt out at that point. You want to actually just build it up nicely so that when you're sort of putting um, more time in, you're actually, feeling up to it, with less risk of burnout. So, which is why I always say you should just sort of build the exam into your life. I mean, obviously, it's for a 6 to 9 month period. And then, obviously, at the end of that, you can actually chill out afterwards. Um, just because the exam is very daunting. And then doing it once is tough, and then doing it twice is even harder as well. So, it's just important to try and get it done if you can. So, if using a 9 month window, this is just a quick summary. Um, if you have 9 months, I would say in the first 3 months, you can have a core test and a reference test that you go to. You can either choose to use core radiology, and you can either choose to double check stuff from Danet or double check stuff from Radiopedia. Um, I think you should use a system based approach. So, primarily, you should be studying core, crack the core, and doing a question bank. So obviously we have 6 modules, and the questions are going to come based on those 6 modules. So you have 40 questions for each module. So I'll probably say over a 2 week period, try and read the core, crack the core part of that particular system. So for example, GI. And then if you're using either FRCR exam prep or Oxford, you can do the GI questions. I think one thing we're always afraid to do is doing questions early. You need to do questions early because you need to actually know what you know and what you don't know. So I think if you do this over a 12-week period, that's over 12 months, you would have actually managed to have gone through crack the core and have actually gone through a large chunk of a particular question bank. Um, and then I think you should start listening to podcasts if you can, or listening to a bit of video resources. Now, for the next 3 months, so this is month 3 to month 6, within a 9 month window, I don't think you should be using any core test at that point because I just think it's a waste of time. And I think you should focus on solving as much question banks as you can get your hands on, particularly the ones I showed, I found useful. FRC exam prep is really useful at this particular stage. If you have a flashcard or you can make flashcard, that's also very useful as well. And at this point, you can try and review practical as well. And I think you should only be looking at your reference resources for sort of difficult and very high yield concepts. If you're still failing questions on achondroplasia or failing questions on, differentiating benign liver lesions, I think you should go to either Dennets or StatDX and read those topics. Very important for you to read them. And then again, you can still, a bit of podcast in the background. And then for the final 3 months, again, I think you just crack the core. Find your high yield questions, questions that you keep failing, try and go over it again. And then this final 3 months, this is part of your final 3 months. I think you should start your mock question banks at this point. I think aim for a mock every 3 days, which will obviously allow you like a free week for your final revision before the exam. And then revisit difficult concepts, look at podcasts, listen to podcasts for concepts that you're still struggling with. as well at this stage. But if you're in a rush and you want a very short version, I think if you do Oxford and crack the core first, and then use Wikipedia for your reference, and if you can try and do FRCR exam prep, you'll be fine. And if you do these resources very, very well and very thoroughly, you'll probably be fine. This is probably what I'll recommend if you're short of time or if your exam is in November. I think if you can do crack the core, use Oxford first and crack the core, use Radiopedia for your reference for things you don't understand. Try and do FRCR exam prep if you can, and then do those 11 mock exams in the final FRCR book and get through. I think you'll probably be fine. Um, so top tips, listen to everybody. You probably learn more from people that failed the exam than from people that passed it the first time, in my opinion. So everybody's opinion is very important. But again, you have to learn to discern what's useful for you and what's not useful for you. So always tease out things that you actually find more useful. And again, don't speak to someone that passed the exam 10 years ago. It's very different. They're going to recommend something different. Again, start questions early. Really important. I think we're too afraid to fail most of the time, which is why we don't start questions early. So I think it's really important to start questions early because again, that will sort of focus you in terms of when you're studying. Because remember, you're studying for an MCQ exam. You're not really studying to learn radiology. Stay organized. Just find a system that works for you and try and stick to it. It's a long exam. You don't want to be reading cardiothoracics and you've not actually read GI or you've not actually read head and neck. Because again, remember, it's 40 questions for each system. So you need to be able to gauge that you're actually covering all the systems. So you have to try and stay organized and try and cover everything. I know people that failed just because of the fact that they did terrible, they did badly in one of the systems, and even if they managed to pass through, the other system, it still brought the overall score down. So I think try as much as possible to be average in all the systems. Even if you love, you want to be a chest radiologist, I don't think you should spend all your time reading chest. Try and sort of average it out. Again, you don't want to spend all your time reading breast because breast is going to be about 4 to 5 questions in the exam in total. So yeah. Again, combine resources, but then avoid overload. So you have to just tease out the ones that actually work for you and then stick to it. One thing you don't want is that you don't want to be reading 2 core tests because that's a waste of time. You can pick a core test, that's fine. You can pick a dedicated, MCQ prep test like crack the core. You can have a reference that you go to, and obviously you have a question banks, but you don't want to be reading core radiology and reading Granger analysis. I think it's a waste of time. And again, like I said, you have to learn concepts rather than topics or textbooks because the format of the textbook is not really the format of an MCQ exam. So think about the exam as I have to learn concepts. If you think about it as in MSK, there are 50 topics that I need to know for me to be able to pass the 2A. Okay, and if you write down those 50 topics that you see come up often in questions, and if you learn and know them, you probably pass the exam. And then have a final, good strategy for the final 30 days. And again, discussion groups, I added it because again, I had a discussion group, which I actually found helpful. So we used it to study questions. I think what it helped me to achieve was it made me study when I didn't want to study, for example. If I want to go watch football or something and we have a discussion, then always have to prioritize that. So I think discussion groups are really helpful in terms of going through questions. And, if you're someone that's struggled to actually study alone, then I think you can find out useful. And good luck. Thank you.
Yeah, thank you, Emeka, for your wonderful presentation. Yeah, you guys have outlined everything. My network is acting up. Hello, can you hear me?
Yeah.
Yeah, okay, yeah. I said thank you for wonderful presentation. You guys have outlined everything in a very systemic manner. Thank you so much. So, we'll be taking some questions from the audience and we'd like them to put them in the chat box so I can just get the question from there and answer. Any questions from the audience or comments? Anyone?
So I'll just say thank you for the session. It's been really helpful, and I think both speakers were able to like give approaches that like you can alter based on like what works for you. Just something Dr. Emeka said, just to clarify. So I was trying to find difficult whether is Granger a core text or a reference text? Is it like an alternative to core radiology or to the radiology review manual that you mentioned earlier?
Yes, that's so obviously there are two Granger analysis textbooks. There's these essentials, which I think is a core test, similar to core radiology, and then there's the big, what we call the big Granger analysis, which is more of like reference test. Um, but yes, yeah, it depends on how you want to use them. But I think the big range analysis test is probably more of a reference test. The essentials is probably more of a core test, which is formatted for for trainees.
Thank you.
Okay. Any more questions?
Please, if you have any questions, can you put them in the chat box? I'm seeing a lot of thank yous. But okay, okay. Someone's asked during the group discussion, what questions do you solve? Question bank or MCQs? I would imagine the question banks have the MCQs, but are you like asking what particular question bank that you recommend for
Let's
you?
allow the presenters to answer.
All right.
So any of them can answer, either Mustafa
Is it,
or Mecca.
do,
Let's just understand the question.
does the question mean like as in question banks as in FR, like the online ones or the MCQ books maybe? Is that what?
Oh yeah, possibly.
Is that possibly?
Yeah,
I can only like from my experience. Sorry, I'll like in my experience, we did try the question books in the discussion groups that I had, but it was a bit harder to follow along with it. So we ended up doing FRCR exam prep, like for like 3-4 hours a night. But that was from my experience. I'll see what Mika's.
yeah, I agree as well. I think FRCR exam prep is sort of easier to follow um, in terms of doing this in a discussion group. Although it might be true, I think we managed to do um, I think one. I think we managed to do the Oxford book sort of towards the exam, but again, that was more difficult to follow. Generally, we mainly did that for ourselves and but as a group generally.
For StatDX, there is a subscription, and I think it has to be through like your organization. So we didn't have it in the West Midlands, but when I was a Peninsula trainer before, they did give us. And I think I tried looking if there was a way to get an individual subscription, and it was like really, really expensive. Yeah. And yeah, and Key, I didn't use it very much, so I'll see.
I think yeah, like Mustafa said, I think yeah, StatDX was via our dictionary, um, which is great. For Anki, it's free. I think what we just did was just it's free, but you just have to sort of if you have some of the question banks in like a PDF format, for example, you can just copy them and just make your own bank. I think there was someone that I actually borrowed that I actually made a bank of the question banks. Sorry, of the question books already. The question books were already made into flashcards. So it was easy to just use that and do the questions because that made it quicker. But I think if you like, flipping through the book and the question books, then probably might not have to use Anki flashcards. But what I did was the question books were transcribed into flashcards, and I just sort of used that. Yeah, hope to answer the question. What's the frequency of the exam in a year? I think it's twice a year, isn't it? I think you have the November sitting and you have the April sitting, usually in the UK, from my understanding.
Yes, it's the same April and November for um, all over the world. Like now, you can get seats in Egypt and Pakistan, India, but the same twice a year, April and November, same
Then
as the UK.
Tina said there were 50 questions from MSK that we need to know. No, sorry, sorry about that. I said what I said was that, for example, if you identify sort of 50 key concepts or topics that you see very often that come up in the exam, from MSK, for example, then you can read around those topics. Like it doesn't matter which particular resource that you use or I tried to call radiology or anything else, as far as you manage to cover those topics. That was what I was trying to allude to. Um, I don't think there's any question from Granger and Allison. I know Granger and Allison has a dedicated MCQ book, but I think that's quite old, and I didn't find it useful, so I didn't use it. Um, Yep, and like I said about the Anki flashcard earlier, I just used it to I transcribed questions in the question books into the flashcards, and then instead of just solving the questions um, using a book, I just used the flashcards because the flashcard help you recall questions that you failed. So it's something that FRCR exam prep can do for you. But again, all those other question books are in a book format, and you don't have that ability for you to sort of go back to questions that you failed and just sort of focus on the questions that you failed. So what Anki does is, um, it just helps you um, sort of convert those question booklets into what FRCR exam prep is like, for example. That's a way of explaining it. And again, if I keep forgetting a particular concept, I just put in a flashcard, and every morning I just review it again, just as a reminder. I think I'll let RIGAf answer the question about organizing tutorials and teaching sessions.
Okay. Do you want to, or
Yeah, is it possible for RIGAF to be organizing tutorials or teaching sessions involving mostly high-yield questions from time to time? Uh,
I don't think we have like any structured plan for 2A as it is now. I'm not sure if you have any in mind, Dr. Philip.
yeah, I don't think so.
Yeah,
But
but
we're happy to advise anyone that apart from this session, if you have any questions or if you come across any topic that you think it may be high yield or not, you can just reach out to RIGAF and they will direct you accordingly to the person you want to that will address your concerns. That's what I will
so
say about it. Mm.
yeah, so I just Dr. Philip, sorry, I hope I didn't interrupt you.
Go ahead, no.
Yeah. So I just posted the link to the WhatsApp group that was created for the SD3 Plus for RIGAF members. So anyone who sort of like is having maybe some questions about any of the, I think from 2A and above, 2A exams and above, or like ST3 concerns, can join the group. If you probably maybe need like a preparation partner or maybe people to do group discussions with, you can probably just announce on the group and anyone who's interested can join in. I think that's a thought. Pending something more formal coming up.
Yeah.
Exactly. That answers the next question as well.
Yeah. I think it would be good to sort of similar to, I think the SRT videos were really helpful. I think there was a lot of high yield concepts there. It'd be good to do one, but I think the question is time and um, and and then trying to have a structure to it. But yeah, I think it's definitely something that should be considered. Um, yeah.
Okay. Um, in the absence of any other questions, I think we should be rounding up. So feel free to fill the form and the feedback form and claim your attendance certificates.
Yeah. I was just going to like recommend that we all fill it because our speakers will need sort of like feedback on their teaching, so we can have like an idea of how well we can improve for next time. Or yeah, all right. But if you still have like any other questions, please feel free to drop it on the group page. I've put the link for the ST3 plus WhatsApp group. So I think that's it from my end. I think we have a plan to do the 2B, but that'll be later in the year. Dr. Philip, please don't leave me on the stage.
Yeah,
We have a plan to do the 2B sometimes. Yeah, I think.
yes, but
But
nothing at the moment. So
yeah,
from the look of things, three of us are actually preparing for 2B, so we don't really have time. And
yeah, I
the exam is in
understand.
September. So I think after this, I have to crack on with the preparation for 2B and all that. So maybe after September, we'll probably actually after the first week of October, that's when the Viva should be. So that then we'll
Yeah,
now try to organize something else.
yeah, we're rooting for you guys. Thank you very much for
Yeah,
the presentation,
yeah,
for organizing the presentation, Dr. Philip, Dr. Mustafa, and Dr. Igwe. Yeah.
yeah. Thank you so much, Mustafa. Thank you, Dr. Mecca. I thank you, guys, for attending. Some people had this short notice and all that, but they were here to attend. So thank you so much, and good luck in your preparation for 2A. We're always here to answer any questions if you have any questions. Thank you.
So I'll be stopping the broadcast now. Thank you very much, everyone. Yeah.